Hi everybody, welcome to Healthline. I am Gregory Zarian. So spring is here. March is practically over, and it does not mean that you get to stay inside. It does not mean that you do not get up, go out, and be as active as possible, as we have spoken on every episode of this show. Our mission here is to make you and offer as much information to you to be as healthy as possible. So that also does mean just because you have to wear a mask does not mean you can't get up, get out. And it also just means being a little bit more aware of other people. Social distancing, wash your hands, and just being mindful. How great the world would be if we were all just that much more, a little bit mindful. So we invite you, I invite you all the time to get up and get as much exercise as possible. So that means when you stand up, you are walking on your what? Feet. We take our feet for granted all the time. We beat them up, we stub them. We work them hard. But how do you take care of your feet? Do you take care of them? And here's one thing that I find very fascinating when you think of the malady diabetes. It affects your feet. Have you also wondered, like me, why? Well, I'm going to answer those questions. Joining us from Adventist Health Glendale, and the topic of today is the management of diabetic foot complications, is Dr. Gerard Boghossian. That was a little tongue twister, wasn't it? How are you, doctor?
I'm well, thanks, Gregory.
Thank you for being here.
Thank you.
Out of the gate, diabetes in our feet, what is the correlation?
Well, the correlation is direct, and it's pretty severe. To fast forward, it's called diabetic neuropathy, is the primary problem. So diabetes is a problem with elevated blood sugars. And so the elevated blood sugars have a direct correlation to nerve damage, which causes peripheral neuropathy. It's peripheral nerve damage, not necessarily your central nervous system. So what that does is it causes a variety of issues in your lower extremities. Namely, and the most common is peripheral neuropathy. You'll hear that a million times in my practice.
So when you say neuropathy, doctor, what does that mean?
It's damage of your nerves. And that damage...
Do they get fried?
So actually, we're still studying the direct pathology behind, or the direct correlation behind elevated blood sugars and nerves, but we do know that the nerves are affected. And so simply said, yeah, they get fried, but how do they get fried? Neuropathy peeks its head up in several ways.
Can you hold that?
Sure.
It's a great cliffhanger, because I was already summoned that it's time to step out. Okay, so I'm going to leave you with this cliffhanger, and here's the deal. Why don't you show your feet some love? Take off your shoes, rub your feet, and when we come back, your feet will feel better. See you more on the other side. Don't go away. So did you show your feet some love? Come on. And did somebody show your feet some love? And did you wash your hands? Also, I hope you got a glass of water. So the conversation today is all about your feet and management of diabetic foot complications. Joining us from Adventist Health Glendale is podiatric specialist and surgeon, Dr. Gerard Boghossian. Doctor, we were talking about neuropathy and how intense and extreme it can be, and we left with one cliffhanger. Can you please pick it up from there?
Sure, absolutely. So neuropathy can be mild or it can be extremely devastating, causing limb loss and death. To start from the most mildest cases of neuropathy, diabetics present themselves with numbness in their feet, or pins and needles, or burning sensation, or extreme pain.
But does somebody have to know that they are diabetic to know that there's neuropathy?
Not necessarily. Sometimes.
Is it a sign? Is it one of the signs or symptoms that, I possibly could be diabetic and not know it?
One of the most common signs. One of the first cardinal signs. Patients will come in quite often with signs of neuropathy, not knowing they're diabetic.
Okay.
However, the awareness has been risen dramatically over the past 10 years, I would say. But being in practice for 21 years, patients would come in with very clear diabetic neuropathic signs and symptoms and had no idea they were diabetic. And this can be young patients, it can be elderly patients. But the neuropathy ranges from mild burning and tingling to a severe disease called Charcot-neuroarthropathy. It's a tongue twister, but it literally causes a meltdown and and severe derangement of your lower extremity, your ankle and your foot, and you end up with open ulcerations, abscesses, hematomas, and if it's not managed by somebody with a lot of experience, it can result in limb loss. One thing I do want to say about limb loss, because we'll talk about it, people don't realize, and healthcare professionals, a lot of healthcare professionals don't realize that there's a statistic out there from the American Diabetic Association that 50% of patients that lose a limb die within the first 5 years. And it's a phenomenon, and they have not been able to find out exactly why. But half the patients that lose their limb die within the first 5 years.
Is that losing their limb due to diabetes, or just?
For any reason.
For any reason.
For any reason, yeah. And they're still researching why, because there are obviously several reasons why patients can lose a limb.
Sure.
But the most common reason is diabetes or peripheral vascular disease, which most often are related.
So let me dive into the beginnings of all of this. If someone wakes up and they are chronically feeling a little burning sensation, pins and needles in their feet, would it just be their foot, or would it go up a little bit to the calf, to the shin, go higher, or specifically just the feet in the beginning?
So if they're really aware of
and
what's
they also
happening,
don't have the diagnosis of diabetes.
correct. So if they're really aware of what's happening and they start feeling these symptoms, and if they catch it early, it will be in the toes. It'll start in the toes, and it'll slowly creep up.
Is there a discoloration of the feet?
There can be. It depends. Typically not until the neuropathy can get severe and start to really affect the circulation and the nerves, et cetera. But in the beginning, simple numbness and pins and needles. However, one interesting thing is that the neuropathy with diabetes usually is on both sides.
Okay.
Because we can have neuropathy from other things as well, like back injuries, spine injuries, et cetera. But or there's idiopathic neuropathy, which there's absolutely no medical reason behind, but the patient has the signs and symptoms. But typically, if you're having these symptoms in both feet, that's one of the cardinal signs of like a diabetic peripheral.
Side by side?
Side by side, both feet, bilateral, yes.
Just say somebody wakes up and their left foot is numb and then the right foot is numb for a couple days and then it goes away. Could it just, what could that be? Could that be just?
That could be a number of different things.
Okay.
That's usually not diabetes.
Okay.
They strained their back, they strained a nerve, who knows what happened, their legs swole up from an activity or something caused some type of pressure on the nerve, but that's not your typical diabetic peripheral neuropathy.
Because one thing I have found doing this show is a lot of people, and I am guilty of this as well, that I will dive into my Google and Google everything. And I will freak myself out, flip out, already bury myself, and I had pulled a ligament in my shoulder.
Yeah.
You know what I'm saying? Like, okay, yeah, he was a great guy. People loved him, and he's in heaven now. So if somebody has the tingling, a little bit of burning sensation of pins and needles, and it comes and goes, pretty much everything is fine. But if it's chronic, like what are we looking at in regards to, oh, hey, you know what, this possibly could be?
So to go back to your comment about pretty much everything is fine, if you're having any of those symptoms in your lower extremities, something is causing it. So pretty much everything is not fine, but it doesn't mean that it's diabetic.
Okay.
So if you're having any of those symptoms in your lower extremities, including your feet, you should have it looked at.
Even after one time, or we're looking at it a couple times?
Well, no, a couple times.
Okay.
I mean, a once or twice episode can be whatever, but if it's something recurring, and we call it waxing and waning, if it's coming and going, et cetera, something's telling you that there's a nerve there that's unhappy, or there's a system there that's unhappy. But the topic of our conversation as far as diabetic neuropathy doesn't work like that.
Got it.
It comes and it stays, and unless you control your blood sugars and regain an active, healthy lifestyle, which is also not a guarantee to control it, it will progress. And the progression of this can be devastating.
When we talk about diabetes, is it type 1 or type 2 we're talking about, or both?
Both.
Okay.
Both. The difference in the types is how you ended up with the high blood sugars, but the end result is high blood sugars.
I'm going to put it right there. When we come back, more Dr. Boghossian. Don't go away. Our visitation guidelines have changed with Los Angeles County entering the red tier. Some limited visitation to patients in the hospital is possible. Please check out the details on the hospital's website at adventisthealth.org Glendale. Joining us is Dr. Gerard Boghossian, podiatric specialist, podiatric surgeon from Adventist Health Glendale. Doctor, I want to ask you first and foremost about your medical history and what got you into the conversation of feet and podiatry.
Very interesting question. No offense to other specialties, but patients ask me this all the time. And I tell them, well, if you think about all the specialties in the office, because they ask me, why do you want to be around feet all day? And I tell them, well, you know what does a proctologist play with all day? Or what are urologists doing all day? And then they look at me like, oh yeah, the feet are
You're like, you win.
a lot different alternative. So, I mean, it just happened. You know, I got out of school, joined the Army, wasn't exactly sure what I wanted to do, was a combat medic, OR tech. I had a lot of surgical experience by the time I was, I don't know, I joined when I was 17. So by the time I was 20, 21, 22, I knew that I wanted to get into some type of sports medicine or surgical. And, you know, I had friends and et cetera in this field, family members. So I was just, it was a very natural progression. And so, you know, that's 21 years later, this is where we ended up.
And where did you,
speaking to the famous Gregory Zarian.
And I'm with the doctor, the famous Dr. Boghossian. Where did you study?
So I went to Cal State Fullerton, and then I went to the Des Moines College of Podiatric Surgery.
Thank you. We left it off in regards to diabetes 1 and 2. Real quickly, can you just share with us what diabetes is?
So simply said, diabetes is a disease where your blood sugars are elevated, and that can be due to a number of reasons, mainly related to the pancreas, but we won't get into the medicine portion of it. It's elevated blood sugars.
Okay.
And these elevated blood sugars wreak havoc on your entire body, from your eyes to retinopathy, to your kidneys, nephropathy, to your feet, peripheral neuropathy, et cetera, and all of those related illnesses can be devastating.
Some people are born with diabetes and diabetes
type
in there.
1.
Type 1, and then type 2 is?
You develop it after birth. After a few years, you could develop it at any age.
You said something a little while ago about just, and I wrote down rise in obesity. Are we dealing with a lot more diabetes, neuropathy, because our country specific, we're the most obese country in the world. Is it because of the way we eat? Is it because of our fast food, quick takeout? Is it because there's not such a green diet here?
So that's a great question. You know, I'm not the best qualified to answer that, but my answer as a medical professional would be, you know, you can partly blame it on the FDA.
Sure.
With the high fructose corn syrups in our kids' cereals and all the crazy chemicals allowed in our food, et cetera, et cetera. The advice I give my patients when they come in, I tell them, look, the two best non-medical ways to control your early diabetes is diet and exercise.
Got it.
And I don't care what it takes. You bring those blood sugars down, and you will slow down the progression of this thing. And a lot of times, patients will show up a year later and say, hey, I'm not diabetic anymore. I'm off my meds. I'm off this. I feel great. And they're 30, 40 pounds less and in great shape. So, but there are also those that are not as fortunate and cannot reverse the disease. So it's the big deal is awareness is significantly higher now than it ever used to be. And so now that we're so aware of diabetes and so aware of its devastation, that the gatekeepers, the primary care, the family practitioners are doing a phenomenal job.
They are.
At monitoring and finding and diagnosing and catching early. And so that's
as we've discussed with cancers and
correct.
You know, breast cancer, self-exam, doing all of it.
Correct.
Somebody wakes up and they have the chronic pins and needles. They end up seeing a doctor. They are diabetic, in fact. How do you control the neuropathy? Because my father had it. My father had cancer, and he said that he ended up getting neuropathy in his feet, and it was like walking on hot water balloons.
Yeah.
And he said it was horrible. If somebody is diagnosed with that, what do you do?
So, you know, that's where to control a severe case of neuropathy, which is what you described earlier, that's a medical problem. There are certain medications out there designed specifically for neuropathy. Are they good alternatives? Not really, but we don't have that many, because they in and of itself have very common side effects, like the Neurantins and the Lyricas, et cetera, et cetera. I mean, your options are not many. There are some natural remedies. There are some, for mild cases of neuropathy, there are some supplements now that are out there.
Such as, so I don't miss it.
Well, am I allowed to give names of?
Please, throw out some
so
supplements.
we use one in our practice called NeurRx. It's a supplement, and it's very safe to take. It's got no effect on the kidneys, et cetera, et cetera, because that's another thing you have to worry about with diabetic patients is their renal status, their kidneys. So they're not, depending on what stage of diabetes they're in, a lot of them are not candidates to take all the medication available. So we have some luck with early diabetes. There are also neuropathy compounds now. There are compounding pharmacies that are making topical ointments that are working transdermally. So, I mean, as this diabetic revolution has occurred in America, and now we realize we have a big problem, such as all the other developments that we deal with. Technology is really advancing, and so we're having some more options as physicians on how to treat these things. I personally don't manage the neuropathy myself. My neurologist colleagues or the family practice or the internal medicine guys are often consulted, because I don't do long-term medical management.
Sure.
I fix your problem, and then 5 or 6 months later or a year later, we part ways, and if you have a problem again, you come back. But so it's long-term management is really what you need.
Before we head out into our next break, do you consider it epidemic status?
It's a pandemic.
Pandemic.
It's not even, it's been a pandemic. It's been a pandemic for well over 10 years.
Wow.
Because it is worldwide.
More with Dr. Boghossian when we come back. Don't go away. Welcome back to Healthline. Joining us is Dr. Gerard Boghossian. Doctor, then what are some of the bad outcomes with diabetes and neuropathy?
So, the worst outcome obviously would be loss of your limb or loss of your life, but the common outcomes are diabetic ulcerations. And the layman's definition of this is if you have normal sensation in your feet and you don't have any neuropathy, Greg, you'll feel if you're walking on a pebble, or you'll feel if you're walking on a hot surface, or you'll feel if there's a piece of glass in your foot.
Like I feel everything.
Yeah, good, because diabetics with neuropathy don't.
Okay.
And so by the time they come in, they tell me every time I step on a hard surface, I hear a tapping, and then I'll look underneath and there's a thumbtack embedded.
No, there's not.
Sure, absolutely. There's a thumbtack embedded in their foot, or a rock horn kernel, or it goes on. And then by the time we get to it, there's an abscess and pus. That abscess has reached the bone, et cetera, et cetera. Now we're shaving bone. They're on IV antibiotics, et cetera, et cetera. So it can be very bad. And now we're removing parts that are bad and trying to salvage that limb. Okay, and that's 911 that's a 911 emergency. I mean, for the leg.
Sure.
So now we're performing limb salvage. So education to my patients is very important as well, not just practicing wound care or diabetic foot management. And so education and prevention, because it's very common that we'll heal a patient 5, 6 months, a year, 2 months, whatever it is, and 3 months later they'll be back because they don't know they have a problem. They don't have sensation under their feet, right? So a patient will come to me and tell me, oh, I was at a barbecue, or I was at the beach, and I looked back and the skin of my feet were 10 feet behind me on the pavement, and they'll come in with no skin underneath. They just don't get it. Because when you don't feel it, you don't understand the gravity of it, right? Until you go a couple rounds with it. So management is a big deal. Education, community education, patient education is number one.
Also family conversation.
100%, absolutely. So
and when you say like walking through the beach and the skin has been left 100 yards behind you, is it elderly people, or it doesn't matter?
No, it doesn't matter.
Okay.
Doesn't matter.
Because a lot of people think, oh, it's my grandma, my aunt. It could be anybody.
Absolutely.
Got it.
I have diabetic patients with ulcerations and osteomyelitis and gangrene that are 30 years old.
Okay.
And I have patients that are 80 plus years old. I mean, the age makes no difference.
And the treatment would be topical, internal.
The treatment is, the treatment...
Depending on where somebody's
the treatment is never standard, Gregory.
Okay.
The treatment always changes, and that's why you have to have a lot of experience with wound care, because it's a very broad range of problems. We're treating the muscles, we're treating the infection, we're treating the blood, we're treating the bones, we're treating the biomechanics of the foot, because not only, it's one thing to go in and take off a metatarsal or restructure or remove an infected bone, but you have to leave these people with a foot to walk on.
Sure.
With a functional foot to walk on. So that's when the braces come in, and the the diabetic shoes come in, and so even the bone balancing, the tendon balancing, you can't leave them with 3 toes and take off 2 toes, et cetera, et cetera. So it's a whole specialty. It's a whole world of medicine in and of itself.
And bottom line too, though, is when somebody comes in and is treated by you, it doesn't just mean that once you are treated by the doctor, you get up and go out and go back to your old ways, because those ways brought you into your office. And some of it is hereditary, but you were saying earlier in regards to information and education. Can you educate us in regards to just even with lifestyle, how to not end up in your office?
Yeah, that's a great question. I tell all my patients, my diabetic patients, I say, don't walk barefoot, ever. Have a pair of slippers in the house. Never go barefoot outside. Always look at your feet every day before you go to sleep. Look between your toes, look underneath your underneath your feet. If you can't get there, just everybody look. See for irregular color, if there's discoloration, if there are any red spots. A simple callus can turn into an amputation with a diabetic. Because if you think about it, a callus is like a pebble, right? It's
sure.
like taping a pebble to your foot. You and I will know it's there, so we'll offload our foot, or we'll shave that callus off, or whatever. But somebody who doesn't have feeling will core a hole all the way through their foot with that simple callus. Or they'll come to me and say, oh, my foot's red and there's oozing between my toes, and we'll look in between and we're peeking at the bones, because they have no feeling.
But here's another thing too, is when somebody said, oh, I can't see under my feet. Yes, you can. Go buy a mirror, put a mirror up. If you ask your kids, we always say here, I say here, check your partner out.
Right.
Look at each other from head to toe. Even if you don't have diabetes, you could have athlete's foot. That, you know what I'm saying? It's
Correct.
just being really mindful, head to toe, of who you.
Yeah, it's
your
a
body.
lifestyle change, and they have to accept it and understand how important it is.
What do you say to the person that doesn't take it as seriously as you're offering it?
See you soon.
Wow. Okay, that was wow. No, but I love. No, I think you're transparent. It's,
yeah.
If somebody's sitting on the couch and 2 years later they are suffering from, high sugars and blood pressure, and they all of a sudden are obese, and there's pizza boxes and ding dongs next to you. It just didn't happen. We just don't wake up and boom, here it is. There are things that we are actually indeed. I had Barrett's esophagus.
Yeah.
It wasn't great. And my doctor said, do this, do this, do this. I had the endoscopy and colonoscopy. It's gone because I paid attention.
Yeah.
I lost 30 pounds. I got my life in order. And I don't want to be one of the statistics that per se could end up in your office because I wasn't paying attention to everything that you were offering.
Correct.
Final thoughts in regards to neuroma and diabetes and how to not end up in your office.
Neuropathy and diabetes.
What did I say?
Neuroma.
You're
thinking.
It's so much about me.
You're thinking your foot.
But I'm taking care of that neuroma. What are your final thoughts on that?
If you see that you have any symptoms in your feet that are recurrent, get them checked, and get them checked by a qualified specialist. If you have any type of underlying health issues, check your feet once a day. Look in between your toes, look underneath. If you see any irregularities, any spots, any dots, any discoloration, if your feet are turning purple or brown, if your legs are swelling, get it checked. Don't expect it to clear itself up. Have a professional look at it before it becomes a problem. I always tell my patients, let's put out a small fire instead of a big fire. Okay? It's always better to put out a small fire than a big fire. So.
Thank you so much for your time.
Of course, thank you.
It was a pleasure. Okay,
Likewise.
So you heard it from Dr. Boghossian. Pay attention to your feet. We beat them up, and here's one more important solution. Talk to your family, ask your parents, ask your grandparents, have a conversation, and also eat more green, eat more healthy, and there's no reason why you can't get your heart rate going. Remember, the most important conversation you're going to have is about you and your health. So have a big conversation with you and your family and friends. And final thought, please don't let your guard down as COVID pandemic still continues. Wear your mask, wash your hands, watch your social distancing, and if you're not feeling good, stay home. Pay attention to yourself, which means paying attention to the ones you love. You can find us on social media. You can visit us on Facebook at AH Glendale. You can find us on YouTube at Glendale, at Adventist Health Glendale, and you can find me at Gregory Zarian. Take care. Give some love to your feet. We'll see you next time.